Hello, my name is Mrs. Tench. Today we're going to be talking about Chapter 14, Substance Use and Addiction Disorders. Substance use disorders we're going to talk about first. Let's talk about when a client is addicted to a substance. What does that look like? There's a physical dependency that occurs. There's a need for increasing the amount of the substance to produce the desired effect, and the syndrome of withdrawal occurs when this substance is stopped. And there's also a psychological dependence, an overwhelming desire to repeat the use of the particular drug to produce pleasure or avoid discomfort. So remember, when we're talking about substances, they have an impact on our brain and our whole body. There's circuitry in our brain that stimulates the pleasure center. And when you have these endorphins released from that pleasure center being stimulated, the body enjoys that and the mind enjoys that. And whenever the substance is introduced, the brain gets that, endorphin response, and then it cascades into that pleasure center being stimulated. And the more that's stimulated, the more the body craves and the mind craves the substance. So that's where addiction comes in. Some brains are genetically more susceptible to addiction than others. And we're going to talk more about that. So just remember, there is a holistic impact of consequences from substance use disorder, physically and psychologically. So with this addiction, the substance interferes with your ability to fulfill your roles, that's when we start to talk to the client about some of the substance use and how it's impacting their daily life. So back to mental health versus mental illness. As you can see, if they're having problems with role implementation, they're moving into the spectrum into mental illness. So also, if the client cuts down or controls their use, it fails, then you start to see negative impact on self-worth, self-esteem starts to decline. There's that increased craving for the substance. With addiction, there's a lot of time spent trying to procure the substance and to recover from its use. So that's substance addiction. So the use of the substance causes a person difficulty with interpersonal relationships or to become socially isolated, just like when we talked with mental health disorders. That's why it falls into a mental health disorder, because the impact it has on the brain and a person's mental health. And sometimes the person will engage in dangerous activities when they're impaired by the substance. And tolerance develops. And a lot of people don't understand the phenomena of tolerance. So I want to make sure you do understand this, because it's very important. When you are exposed to a substance, your body develops a craving for more, and you need to have more to get this same effect. That, say, I'll use alcohol for example. Say you would drink 2 or 3 beers, and then you'd get that euphoric response, and then 2 or 3 beers isn't giving you that same euphoric response. So then you have to drink a 6-pack, and it's still, again, this tolerance is something that our brain pathways and that pleasure center strives for. They want more, and it takes more, and so tolerance increases. In our society, unfortunately, we like to blame people for addiction, even though we've just discussed how it impacts our brain, and then the organic response, and then the deterioration of the brain occurs, and tolerance is very dangerous. And I'll use an example of tolerance with opioid use also, because you see that people have chronic pain issues. They're prescribed opioids to support that, and then tolerance occurs, and you need more. And that's just the phenomena in our body. It's not a character flaw. So let's say your patient has chronic pain and they're on fentanyl patches. Okay, so they start on 25 mics per patch. And then after a few months, 25 mics is not controlling their pain. So we have to increase it to 37.5 mics, okay? That's expected. If you worked in palliative care, you know that's expected. So it's not a character flaw. And I've heard people talk about this because of lack of knowledge. They don't understand their drug seeking behavior. And of course, there is that component to it. That's when we need to step in as healthcare providers and offer support, okay, not judgment. So please be mindful of that as you're caring for your clients. And there is addiction that occurs. I've cared for many patients who I worked in oncology, I've worked in home health, and once that substance stopped, there's going to be withdrawal. Okay, our bodies get addicted, and that's what we're talking about. And there's different methods to help us with that withdrawal process, and we'll talk more about that as we go on. So then the substance is induced disorder can be referred to as substance intoxication. So we talked about addiction. Now we're going to talk about intoxication. That's where the development of reversible syndromes of symptoms followed by excessive use of the substance. It has a direct impact on the central nervous system. Let's use alcohol, for example. Alcohol is a depressant. You do get that euphoric response initially, but it is a depressant in the central nervous system, and that is why people, use the substance, they abuse the substance, they become intoxicated, and we have to be able to recognize signs and symptoms of intoxication. There are physiological signs, psychological functioning is impaired, their judgment's impaired, they have social and occupational function impairment. Of course, that's why it's a mental illness. And substance withdrawal. So we talked about addiction, we talked about intoxication, and now we're talking about withdrawal. All right. So the substances stops abruptly, and they start to have problems in their thinking, their physiological changes, thinking changes, feeling changes, behavioral changes when the substance is withdrawal. Sometimes our patient can be very agitated when the substance is being discontinued. And the substance withdrawal are specific to the substance that's been used. All right, so for our course, in your textbook, there's a list of psychoactive substances. Some of these are more acceptable in our society. Alcohol, for example, social drinking. Some people can be social drinkers, and others have more of an addictive pattern in their brain, and they have that substance exposure and they're addicted. That's, you look at genetics, especially with alcohol. There is a close tie to genetics and alcohol use disorders. Caffeine, I'll be honest with you, I have to have coffee every morning, so I'm addicted. But there's a Starbucks on every corner, so isn't that more of an acceptable addiction in our society? But nonetheless, it still does the same thing in our body. So when we try, like when I don't get my caffeine, I start to get headaches because that's that central nervous system response. We are going to talk about cannabis, we're going to talk about opioids, and we're going to talk about alcohol for this course. There are many, the hallucinogenics, you can look in your textbooks, inhalants, sedatives, hypnotics, stimulants, and tobacco. But for this 15-week course and only having one week to discuss it, we're just going to have to limit our content to those three. So We were talking just a moment ago about the predisposition factors, where there's a genetic component. Then, the biochemical response, and here we go. Alcohol may produce morphine, morphine-like endorphins in the brain that are responsible for alcohol addiction. Another factor may be psychological factors. Here's Freud, for example, protecting your ego. You have a fixation of the oral psychosexual phase of development, and that's, something that is very Freudian in nature. And there's psychological factors, personality traits. Are thought to increase the tendencies toward addictive behaviors: low self-esteem, frequent depression, passivity, inability to relax or defer gratification, inability to communicate effectively. So these are some predispositions to identify people who are at risk for developing substance addiction disorders. And then there's a cultural factors, social learning. Children and adolescents are more likely to use substances when their parents have modeled that behavior, or their peer group and encourages that behavior. There's also a conditioning. Pleasure effect from substance use act as a positive reinforcement for continued use. Okay, that's where our pleasure centers in the brain come into play. And then there's also a culture and ethnic influence. Some cultures are more prone to substance use disorders than others. Here's a question for you to consider as we're going through our slides today. Okay, just like we said, the research suggests that hereditary factors involved in the development of substance use disorder, especially with alcoholism. All right, so let's talk about an addiction, this substance, when we're using alcohol. Remember, I told you we're going to talk about alcohol, opioids, and cannabis. All right, phase one, they're exposed to this substance. There's stress in their life. I know in our society now, with things that are going on, people are like, oh yeah, I have to have a day drinking is very common. I have to have a toddy every night. So that's that pre-alcohol. I'm stressed, I need to drink. Then phase two is when you start to have that early alcoholic phase. There's some blackout that occurs, some amnesia, and it takes a while to recover from, we call it a hangover. So that's occurring in phase two. In phase three is that crucial phase. They've lost control. A lot of our patients in the mental health setting are in phase three. They've lost control. They can't stop it. It's impacting their life, their relationships. They've lost their job. And then there's this chronic phase. There's an emotional and physical degeneration that occurs, and a person is more intoxicated than they're not. What is, when we're looking at these different substances, what's the impact on the body? Peripheral neuropathies occur. Myopathies, muscle weakness, a wasting of skeletal muscles. We see that our patients are thin, and sometimes because of lack of nutrition and absorption, and sometimes they would rather drink than eat. If they had to make a choice on buying groceries or buying their alcohol, if they're addicted, there is no choice. They'll go with their withdrawal if they don't get the substance. Then Wernicke's encephalopathy, changes in the brain related to thiamine deficiency, very important to remember. If they don't receive that thiamine replacement in the hospital, death will occur. And their Korsakoff's psychosis is they're confused and disoriented confabulation in alcoholic patients. They have blackouts, they can't remember, so they make up stories about what they think happened. And there's cardiac changes due to the accumulation of lipids in the myocardial region. Enlargement of the heart occurs. Esophagitis, there's inflammation and varicosities occur, and it's, life-threatening. Hemorrhage. Sometimes they're vomiting and they're going to irritate that mucosa. Gastritis, very common. Stomach cancers occur with chronic alcoholics. Pancreatitis, very, very painful consequence. The pancreas becomes enlarged, and severe nausea, vomiting, and pain. And chronic pancreatitis leads to malnutrition and weight loss, and then diabetes mellitus occurs. And then hepatitis. You may have seen patients who are exposed to alcohol for long periods of time. Their liver becomes enlarged. They develop ascites, and cirrhosis will occur, end stage of alcohol liver disease, widespread destruction of the liver, and scar tissue. And then portal hypertension, because you're having that resistance. The liver is not able to circulate. It's mostly scar tissue, and that's your filter organ. So you're going to have impending death. Ascites, again, from the accumulation due to the organ not being able to work efficiently. And there are varicosities. That's very dangerous. I've seen people have to have a reconstruction of their esophagus and have temporary stomas, and it's just very challenging to see, and it's from the substance use disorder. And then there's also problems with the bone marrow, platelet production, white blood cell production, then sexual dysfunction can occur. So here's another question. It's about the thiamine level. A patient's blood alcohol is elevated. So, this is why we give thiamine. Wernicke's encephalopathy. All right, so I'm briefly going to talk about fetal alcohol syndrome because it's so apparent in our society. Unfortunately, babies are born addicted, and when the mother is exposed to illicit drugs and alcohol in utero, it has severe consequences. And just for you to advocate for people, it used to be socially acceptable for patients to drink. One drink is tolerable when you're pregnant. Well, now we know that's not true. We don't want our children to be born with these severe consequences of alcohol use. Learning, memory, attention, communication, they have a certain look about them when they have fetal alcohol syndrome. And we see that at Cumberland, and we're not going to Cumberland Hospital this semester, so I wanted to let you know that it is very damaging to the unborn fetus. So alcohol withdrawal occurs about 4 to 12 hours after the last drink. And that's important to remember. So let's say your patient had their last drink at 11 p.m. In the morning, they are going to have some signs of withdrawal, shaking hands, confusion. They need to have a drink to decrease the withdrawal, okay? So they can function. And I had a student one time say, well, Mrs. Tinch, they have to drink their breakfast. And it's so true. So I've seen patients brought in TDO'd into the hospital. One particular patient, 6 a.m., he's there. I go in early to check this milieu and see how things are going to be for our day. And he had been TDO'd, brought in temporary detainment order for intoxication, a danger to self and others. And he was, starting to go through withdrawals because his last drink before he got arrested was like 10 p.m. And so he was really struggling. And, he was having difficulty sitting still. He was shaking in his hands. He was irritated. And, he said that part of his addiction, which is alcohol, is related to his employment because he's a painter. And when he goes through withdrawal in the morning, his employer will say, you need to drink because your painting is too sloppy when you're not drinking. So, he's stuck. Of course, that's unfortunate because through time, if you withdraw from a substance, those initial withdrawal symptoms will stop. Okay, but it takes time. And I thought that was a little denial that he was using by saying his employer told him he had to drink. Okay, rationalization and denial. That's what I was thinking when he was talking to me about it. Let's talk about opioid use disorder. What does someone look like that has a substance use disorder? So let's talk about the substance itself. It's opioids has a natural origin. There are derivatives we use in the hospital setting to block pain receptors, your Percocets, your oxycodones, your hydrocodones. That's the synthetic. So what does it do to our body? It impacts our central nervous system. Also, gastrointestinal, cardiovascular, and sexual functioning. And you're going to have intoxication, you have an exposure, you get that euphoric response, and then it's followed by apathy, dysphoria, psychomotor agitation, or retardation. I was helping a student go through a chart the other day. A patient was TDO'd, and they said psychomotor retardation, slowing. They're like slow-mo, okay? And retardation, I don't like that word, but it means slowing. Okay, severe opioid intoxication can cause respiratory depression, coma, and death when your tolerance goes up. And I'll tell you a story about a girl that I worked with. Her husband was addicted to heroin, and he had stopped for 10 years. Well, when he went back to the addiction, he started taking what he had left off with dose-wise. Remember talking about tolerance, so he went in how much ever he needed before he started with, and he died from respiratory depression. So that just shows you his tolerance was high when he was a user every day, but once he stopped for 10 years, then he went back to it. So it's a lifelong struggle for some patients. Heroin is a short-acting drug. Symptoms usually of withdrawal occur with 6 to 8 hours. Peak withdrawal in 1 to 2 days, and gradually subsides in 5 to 10 days. And then there's some type of methadone we use sometimes to help with withdrawal. We use that substitution kind of treatment that we're going to talk about. But it's addicting too. But we try to taper substances. And what does it look like if somebody's in opioid withdrawal? They're dysphoric, muscle aches, they have tearing in their eyes, runny nose, pupil dilatation, diaphoresis, GI upset, yawning. So I'm sitting in the milieu and I see people that are tearing and have a runny nose, and there's a gait that they have. They kind of walk sideways with their gait. So you pick up these little subtle signs of addiction, withdrawal from opioids. And then cannabis. There's a misconception that cannabis addiction is not as bad. It's legal in some states, and I've heard that. But there is research that it's physiologically addicting and psychologically addicting, and it has detrimental impact on or the brain, organic changes that occur. So it affects the body cardiovascularly, respiratory, reproductive, central nervous system, and sexual. So that, people who say, it's legal, how bad can it be? Well, alcohol is legal too. So, but it's got some consequences that are life altering and life threatening. So when you are intoxicated with cannabis, you may have impaired motor coordination issues, euphoria, anxiety, paranoia, impaired judgment. You're going to have physical symptoms, dry mouth, tachycardia, increased appetite, and this impairment can last for 8 to 12 hours. And you do withdraw from it if you have a heavy use disorder of this. And when you stop this, within a week, you will have some, irritability, anger, aggression. Just show you it has cognitive impact. And look, so physiological impact, sweating, diaphoresis, headache, things of that nature. So now I'm going to stop this video, and part 2 is application of the nursing process.